Good evening, everybody. It is New Year's Eve, 2020. We're about to jump into 2021, and what better time than to put together a short, hopefully useful discussion about vaccines, particularly the lots of attention with the COVID-19 vaccine process that's been going on now, and just entering our community with vaccinations already beginning at local hospitals as an example. Before the Christmas holidays, we had a number of very anxious phone calls into the clinic, and I thought this might be a good opportunity before the new year begins, and obviously a conversation that will be ongoing because things continue to develop. But I think I would suggest that there was quite a lot of fear and apprehension about something so unknown, especially vaccines that are being perceptibly pushed very quickly before what a lot of people have shared with me, concerns about adequate testing. So I thought, let's take this opportunity to at least go over what we do know, and maybe we'll do some subsequent follow-ups to this video discussion. I wanted to read a quote from Earl Nightingale, a U.S. author, who was quoted as saying, "Whenever we're afraid, it's because we don't know enough. If we understood enough, we would never be afraid." He was also known to say that people are where they are because that's exactly where they really want to be, whether they admit that or not. So there's some quotes for 2020, 2021. Just last week, the Oregon Health Authority, Oregon Health Authority put together an updated information-packed webinar for care providers in the state of Oregon. And I wanted to go through the information with enough detail, but not too much. I will be putting up some links on my website along with this video on YouTube, as well as my personal professional website with some additional information. This webinar was hosted and put together by the Oregon Health Authority, and the OHA is comprised of 27 individuals that are the people being tasked with the onerous job of deciding when and where are these vaccinations going to be given, who's going to get them, in what order as far as priority, and so on. So their job continues to be ongoing, but at least as of the end of last week, the information shared, I think, would be worthwhile going through. This was a MD, MPH, a Master's in Public Health physician named Joe Sullivan, who was essentially answering a lot of the questions and providing a lot of the information that I wanted to share with you now. I think some of the big questions have been, when am I going to get my vaccine? When are my family members going to get the vaccine? Is it safe? And so on. So he went through some, I think, points of interest. One was, first and foremost, of prioritization, and how does a vaccine, two of which are currently being used widely, at least what's been shipped out widely from Pfizer, the Pfizer vaccine and the Moderna vaccine. But if we have such a limited supply, how are we going to prioritize who's going to get it first? And this is one of the 5 factors as far as distribution he brought up, is how are you going to decide who gets it first? At least for right now, we are in what is referred to as the step or phase 1A of prioritization. I'm going to flip the camera and have you look at this slide he shared and go over what's listed here. So if we only have a limited number of vaccines and able to give people, yes, as he said at least 2 or 3 times, it would be perfect if we had enough vaccines for everybody, and I mean everybody. But unfortunately, because of production and because of distribution issues, we simply just don't. So what does that mean? Well, the Oregon Health Authority put a 1A prioritization on the following 5 groups. The 5th group just recently added, but the first group has already received and started to receive vaccinations are folks that work in hospitals, urgent cares, skilled nursing, memory care units. These are facilities where healthcare professionals and the residents that live there are the most I would say at the forefront of contracting COVID-19. If these folks get the highest priority, it's because they are seeing the highest numbers and are interfacing and treating these patients. And as we've read in the news, this is where we've had COVID outbreaks in places like residential care centers. This would also include EMS providers, first responders who go into people's homes and obviously are bringing people back to hospital and emergency rooms. Group 2 would be other long-term care facilities, including those healthcare professionals that work with residents there. These would include patients in hospice programs. Here locally in Eugene, mobile crisis care professionals, for example, with in-cahoots would be included. These are folks that are involved with transporting patients, and those that are working currently in correctional facilities. Group 3 would be the outpatient settings that would be of highest or high-risk groups. An example was given would be a nephrologist, for example, working with patients that are on dialysis. It would be extremely unwise to have professionals working with such high-risk groups and not be vaccinated early on. Those going into people's homes to provide home care, non-emergency medical support, so transport between facilities. Those individuals were given the Group 3 priority. Group 4 would be all other outpatient settings, and those would include the support staff that work there. These may include outpatient offices, providers that work in those offices, support staff. And they also mentioned these would include your front desk workers, essentially any of the folks that make an outpatient healthcare providing office operate. That would be included in Group 4. They've added recently in Group 5, which would include teachers and school employees. We'll talk about students and the youth in just a little bit, but this is a 1A prioritization that's at least right now being addressed, and currently that Oregon Health Authority is going to be looking into 1B prioritization, 1C prioritization in Phase 2. These will be determining what order the next tier level of patients would be at most risk. Back the second part of, I think, the challenge of trying to get everybody immunized, other than who's at most risk of contracting it, is as far as delays of getting vaccine, is the actual supply. So we have 2 major companies right now doing as best they can. This is Pfizer and Moderna. These are the mRNA vaccines that are currently being administered to those folks. The U.S. has purchased somewhere around 200 million vaccines over the first 6 months of administration, and the hope is that by the end of February next year, 2021, that groups in that prioritization list I showed you, groups 1 through 4, hopefully, if all things go well with distribution and manufacturing, would all be able to be vaccinated successfully. Pfizer is opening up a second distribution and manufacturing plant in the United States that may help to increase more vaccine availability because of production. There are 2 other vaccine suppliers, including AstraZeneca and Johnson & Johnson, and those are still undergoing approval. Those will be things you may be already reading about in the news. A fourth component of a successful vaccine administration that's been pushed quickly through is what's referred to as uptake. How many people are going to actually take the vaccine? In his report, the good news is among hospital staff and employees, physicians, nurses, and support staff, over 90% have already received their vaccines without any pushback or deferral. And in a sense, if we're going to get everybody vaccinated, this is important for reasons that I'll conclude with. What we really right now, if part of the answer is going to get herd immunity to a point where we can get enough people vaccinated, right now disinformation, conspiracy theories about things that aren't true about vaccines, particularly these vaccines, will not help the general cause. So I will make a plea for hold on with the science and hold on with listening to the immunology experts and the scientists. And unfortunately, we're getting deluged in the media by folks that are coming up with their own opinions about things that they really aren't experts about. My job as a solo doc is to try to relay the information from the experts, not from the media. And hopefully that keeps everybody on the same playing field. Of course, this is an ongoing, changing environment as we go, but this is what we know at this time. This is medicine at its best. We don't have all the answers, but we're making some pretty fierce progress already, and that's some good news, at least for 2021. The concept of partnerships, how are we going to be able to get enough vaccine out to the population? The prediction, and again, this is a work in progress, is that the state, the Oregon Health Authority, will likely be partnering with other larger entities, such as chain pharmacies, with county health departments, possibly with larger entities, hospital groups, urgent cares, in order to allow enough of the vaccine to be shipped to these facilities that will have to prove that they are going to use that amount of vaccine shipped to them, and as well as be able to safely store and administer the vaccines. But partnering with other bigger groups will also tremendously help in this challenge. A reminder that I think is worth pointing out is, yes, a lot of folks have called wondering, when can I get my vaccine? I appreciate their concern and I appreciate their anxiety. The sooner the better for some. Others are still holding off and wanting to see how things go for the next month or so. We will likely not see a significant problem if, well, maybe not a problem, but I think if somebody is at their wit's end that they're going to be delayed by getting their vaccine by a month or two or three, it's likely not going to make a huge difference when we're really trying to go for the whole concept of herd immunity. So if we're not having everybody vaccinated at the same time universally, it may still be okay, and we'll get there. But right now, because of limitations with numbers of vaccine shipments, we're going to be doing the best we can. Now, with that, his reminder was, we in the United States, as a population, we represent like 1% of the world getting access to vaccine, and we have to remind ourselves many parts of the world may not see vaccine, some say for several years. So we may need to pause a little bit, take a deep breath, and remind ourselves how fortunate and lucky we are that we are at least in a country where we've got access to it, though it may take a little longer than what we would choose. Now, one question was about how effective are these vaccines, and the two that I'm going to mention the most are the ones produced by Pfizer and Moderna. Those are the two that are out currently being administered in settings across the country. We're talking about a 95% efficacy. That's huge. And the tens of thousands of people who've been immunized safely, with very few, if any, certainly very few life-threatening side effects, is remarkable. So to have this product come down the pipe so quickly is a tip of the hat to the ability for research and in immunology and vaccine development to be able to safely make products that can quickly get onto the market. And so far, the numbers as far as of how long-term the benefits continue to show themselves with very low risk side effect profile is astounding. When we say efficacy, what does that mean? It means that the vaccine, the two vaccines, they are preventing symptomatic disease and they are preventing severe disease. Now, the lingering question is about transmission. Does it 100% keep somebody from transmitting it to another? And that's still an unknown, and again, one of those that we're still trying to figure out with ongoing research and studies. But there have been no serious adverse outcomes for the number of people that have been already receiving these vaccines. There is a certain amount of what is described as reactogenicity, so reacting to the vaccine. The most common ones are ones that we may have gotten already from other vaccines, like flu shots, the new shingles vaccine. I hear this not infrequently from my clients. Headache, general achiness, a feeling of malaise, almost fluish feeling, and within 24 hours it's passed, along with the local irritation and pain around the site of injection. That is largely the main side effect profile. What's referred to as grade 3 reactogenicity is where folks just can't function. They can't go to work the next day. And thankfully, that's a much lower percentage than many had predicted. Interestingly, when many in the healthcare field and hospitals, for example, were told and given the pros and cons, and they knew about this, they simply took additional Tylenol, Motrin, what had you, and were still able to get to work. So they were predicting a number of folks having to take time off of work, and that just hasn't been shown to be the case so far, so that's good. There have been cases, and this has been a fairly new development both in the United Kingdom as well as in the United States, of cases of anaphylaxis. These are reporting cases in the United Kingdom, in Alaska. We've had cases here in the state of Oregon. The new recommendations for folks who've had any type of previous reactions to intravenous administration medications or vaccines would be to make certain that they are kept for at least a half an hour and stay and not head right out and home after they got their vaccine. And in the case that they would need additional attention for potential reaction, you've got a qualified staff right there, and the requirements would be very similar to what an allergist would do or in an urgent care emergency room setting would do. But what we are now looking at is more patients are going to hang around and stick around longer post-injection so they don't head on home right away. There have been concerns, and it's still being looked at as far as onsets of Bell's palsy, a temporary weakness in the vaccine groups compared to placebo. But some authors have looked at with the tens of thousands of people that have been inoculated already. It may not be as dramatically problematic as was once thought. Lymph node swelling, particularly on the side of the administered vaccine, temporary, not long-term, but it has been described with the Moderna vaccine. With pregnancy and women that are breastfeeding, there's still information that is still to be learned, and there's just unfortunately not a lot of data yet. We do know, unfortunately, that pregnant moms are at higher risk if they develop COVID-19 of going into preterm labor. They're more higher risk of being requiring ICU attention. So we got the sense from the discussion last discussion, telling I think pregnant moms are probably going to be recommended to eventually be getting the vaccinations rather than not. As far as immunity offered by these vaccines, we're looking at 6 to 8 months out that the amount of immunity that's offered by the vaccines is nearly identical to that has been shown with patients who previously clinically had COVID-19 and continue to show, specifically these are T cells, T lymphocytes in the system at high enough rates to show immune defense mechanisms are still effectively on board, ready to go. There were some additional, I would say more in detail kinds of question and answers about the specific vaccines. I won't get into with this discussion. This is more of an introduction to just get some questions out there and get those things answered. There has been a question about the newest or a relatively recent finding of SARS-2. These are called SARS-2 variants. They've showed up in the United Kingdom and South Africa, and most recently in Colorado on the 29th of December. So these variants have shown up as mutations of the SARS virus. And these variants made people question, well, should we be doing anything different with the vaccines? And the answer is no. We're seeing the current vaccines to still be very highly effective, and these variants will not likely change the current recommendations for the vaccine. Are these vaccines mandatory? And the answer is no. This is not a licensed vaccine in the sense that an authority can require or mandate that you have to have these vaccines. So the answer to that question was no, this is not a mandated vaccine by the state. I mentioned the length of immune function demonstrated as up to 6 to 8 months in both groups who had the virus as well as who got vaccinated. So what I wanted to end with was a plea to stick to the science. For many of those who I've worked with in the office, I think you'll know my fairly direct demeanor on this with a number of colleagues of mine across the country, those in research, those in the labs, those either that are in the work environments where virology specialists, folks who know about viruses, this is their day-to-day job. Those are the folks that I am keeping my ear to the ground, as well as the folks with the Oregon Health Authority and those across the country in public health that have the scientific background and field to be able to handle this problem to the best of their abilities. Those are the folks, those are the experts I want to keep my ear to the ground on and not get dissuaded into, I hate to say it, but fear-mongering or disinformation. I hate to say the word conspiracy theorists, but there are those folks out there who want to make a name for themselves and unfortunately sell books and airtime and ad space, but without mentioning some names who've gone, no pun intended, viral with their opinions about these vaccines being dangerous or somehow being part of a bigger conspiracy theory. It's really just inaccurate information and information that's been essentially debunked. The one physician in the Bay Area who took this to task, I happened to put his link in my Facebook company feed for your viewing entertainment. This is Dr. Zubadamania, MD, who again, self-admittedly is not an immunologist, but he knows enough to be able to decipher what's fact or fiction. And I think that's kind of what I want to make sure that we're paying more attention to fact and not fiction. One of the fictitious statements that this one particular author was trying to promote is that these vaccines are somehow going to alter your human DNA. They can't do that. Messenger RNA is a lipid surrounded, or it's surrounded by a layer that enters the cells but never enters the cell nucleus, which is where the DNA is. Messenger RNA simply is a signal to the cell to make protein, particularly to make spike proteins in order for the body to recognize those spike proteins to mimic the COVID-19 spike proteins on the surface of the virus. to make antibodies to that protein. So when and if that person becomes either infected, you've got the immunity ready to go because you've created and developed your own antibodies. So this person and others that I've heard decrying these vaccines because it's somehow going to affect your human DNA is simply not true. It's scientifically impossible. And the reminder is that our cells are bathed with thousands of mRNA particles all the time in the cell itself, in what's called the cytoplasm. So it never gets to the cell nucleus. So that just can't happen. The other was the suspicion or concern that these vaccines were going to have enough metal of some sort that it would create, and I think this particular speaker was talking about aluminum or some other type of metal was being introduced, and was somehow with that amount of metal in those vaccines was going to create an antenna. Your body would become an antenna of metallic messenger in order to pick up 5G information. That just can't happen. It hasn't ever been shown to be a possibility. The amount of, if there is any metal in these vaccines, would be so minute, on the order of nanograms, that this would just not hold a lot of water. And I think the counter to that is, if you think of the human body, we have how many millions of red blood cells and bone marrow full of iron as it is. Our body is largely packed with ferritin, with iron. If we were an antenna for some other deception or malevolent corporate-led process, I think that's already likely going to have happened by now. So that idea of having put metals in somebody's body becoming a lightning rod for 5G transmission, it's just not possible, and it's just not likely to hold a lot of truth. That, I think, is the majority of the things that I wanted to cover tonight. Obviously, we're going to be seeing more developing as these vaccines continue to be introduced. We obviously have lots to stay in touch with our healthcare authorities over, and each day I'm getting updates by not only the Oregon Health Authority, but the Oregon State researching arms, as well as folks that are following this nationwide, as far as the vaccination process, reporting side effects back to the CDC and other health authorities, so we can track people and to make sure that the safety is being followed, and the folks are being cared for, and getting as many people vaccinated safely as possible. So with all of that, I appreciate your attention and time, and I hope this has been helpful. Certainly feel free to contact me after the new year if other questions come up, and I'm sure there will be more questions that come up. I am also going to be intentionally putting links in my, not only my webpage for my office, and I will do that as well on my Facebook and YouTube channel, along with this video, to put some hyperlinks in there for you to be able to look at more details when it comes to specifics with the statements come up just as recently as today from the Oregon Health Authority as far as where we stand. So with that, I wish you all a very happy and safe new year, and we will talk soon. Bye-bye.